Can a chiropractor fix or help chronic low back pain? So we see a lot of chronic low back pain in the clinic. So chronic low back pain is usually characterised by something that's been long-standing, usually for 8 weeks or more. So usually with that sort of patient, they have a pain range of, if 1 was nearly no pain or 10 was the worst pain they've ever been in their life, it's probably between a 1 and a 5. Something that they can live with every day but they notice as well. Acute low back pain is something that's more like a 5 out of 10 to a 10 out of 10, and that usually comes on suddenly. So that could be like a back spasm or something like that when you've helped someone move a fridge. Chronic low back pain can be caused by things such as arthritis, poor posture, muscle imbalances, whether that be from sporting or even just sitting at a desk or poor ergonomics. So chronic low back pain we would treat more with rehabilitation exercises, so we would give the patient some exercises to do at home, but we also in clinic want to try and restore the function around the problem with that joint or that area. Those problem areas can come from joints, discs, sacroiliac joint pain, which is the joint between the sacrum and the ilium in your low back. So some of the treatments we use for chronic low back pain include adjustments or manual adjustments, where we will move the joints and try and restore that biomechanical function, which would then obviously alleviate pain. We could use, say for example, in a case where there was a lot of chronic arthritis, we could use lower force techniques such as the activator or pelvic blocking. Other helping techniques that we use would be dry needling, we could use cold laser, shockwave therapy, and other taping methods such as kinesiotaping. So that will help with a more chronic case. The patient will have the tape on when they leave, and that will help just restore the muscle function and joint function as they're walking around while they're not in clinic. With chronic low back pain, obviously we want to make sure that there's nothing underlying. So sometimes we'll also refer out for imaging, whether that be an MRI or whether that be plain film imaging. So just a normal standard X-ray. And then we will assess that. And if it's something that we can't help in clinic, we will refer you out to the appropriate medical specialist to help with it.